calf.
Yeah, Ruchika has not read my last message, so that means probably she got busy with something.
Yeah, I just
pinned our the link, the Zoom link.
I just saw your message. I'm joining. Okay, fine, thank you. She's joining.
Ruchika?
Yeah. Okay.
Meeting is being recorded.
Today we will be discussing a very important part. Let Ruchika join. Is leg and feet. If it is visible my screen, or it's still circulating?
I think it's a PowerPoint.
Yeah.
Yes. Ruchika is here.
Yeah.
गुड मॉर्निंग सर.
गुड मॉर्निंग रुचिका, कैसी हो आप?
हाँ जी सर, अच्छे.
ओके, कुछ किया है? हैव यू डन समथिंग?
सर सॉरी, मुझे भी टाइम नहीं.
नो प्रॉब्लम. My hands are tied, so I'm forced to do. Otherwise, my algorithm will throw me out.
नहीं सर, उसी से इम्प्रूवमेंट आएगी. I know that.
But anyway, so let me take you through a little bit understanding on leg and feet. Okay?
Okay, sir.
So we have walked on hand. Now, I could have spent more time in hand, but I know that all of us has a lot of other things planned and something will boom come up, and then we may have to leave the session, and then that's where you get stopped. I've seen many of has joined and something came in their life and then they couldn't go along with the sessions. So that's what I said. I cut down the hand part a bit so that we can come back when we will be doing the full entire body. Let us move to the next body part, which is leg and feet, which takes a lot of time because the construction of leg is something like that. Okay. So if you look at the leg, now this is the pelvic joint and this is the pelvic bed, if you say this, and it is been measured in such a way that when the baby born, it fits in here. Okay. Not only that, the evolution of human being is earlier. If you look at the chimpanzees, because the Homo sapiens, you might have heard about Homo sapiens and all. Now, Homo sapiens from here, one segment of evolution has gone towards man, a human being, and one segment has gone towards the chimpanzees. As because men started walking and they never got back to four legs, their pelvic has grown and it has become bigger. But if you look at gorillas or chimpanzees, their pelvics are much smaller. That's why they have a very low waist and a huge broad shoulder. Just imagine a chimpanzee. So the animals which moves on four legs, they have always a smaller pelvic. I hope you can probably you can relate to it when you would be seeing different animals and all. And this is how our muscle placements. Okay, so if you look at here, this is how the cartilage is attached to muscle. Then we have ligaments, and then this is our knee and calf muscle and shin muscles. Okay, so again, if you look at this thin bone, this is responsible for the movement of leg like this. Like in hand, we have a thin bone like this, which is called ulna, which help us move the hand. But we don't see our human being like this. We see the human being like this. But I want you to just imagine it whenever you would be drawing any form of any position. Please keep underline of this consciousness that the bones are like this, and top of it we have all the cover. Okay, so when you do exercise, the heavyweight exercise, your bone density increases, so do the bone volume increases. So say someone who has never done exercise, he's and they are, suppose say I am, which is say around 86 kilo. Now another person, same height, 5'9", 86 kilos, but never did a workout. Now, if someone does a X-ray or CT scan of my body, they will find that my bone density is much thicker than the person who has never done the workout. Anyway, so we will keep all this observation in mind whenever we would be drawing these legs. Okay, from here we will go towards this, and then this is what we understand the alignment of feet, which I will come here, and then we will move to feet. So right now we would be drawing this structure. So by any chance you are carrying pencil and paper? If you are talking,
Yes.
then I'm not hearing because you're mute. Yeah, yes, Manjit. Yeah.
Hirak, one question is, you mentioned about this pelvic area and the how it comes, the bones and the.
Yes.
Is this naturally when you mentioned, a baby coming, and so it's a female thing. So male also same, or is it different?
Same. The pelvics are all same. Only thing is the size of the pelvic is little different.
Okay.
Also, when the baby comes, our body prepares. So before the delivery, these joints start opening up.
Okay.
Few people doesn't open because of the head position, the breast position doesn't come. All those terminology, I'm misleading the terminologies, but other that's how they start getting the pain. Otherwise, so you remember I talked about three kind of joint. One is non-movable joint, slightly moving joint, and movable joints.
Yes.
So the slightly moving joint is this, which moves apart before the baby can make a path through.
Okay.
Okay.
Overall, the leg.
Overall leg, everything is same.
Male and female is
Everything is same. Only few details are changing. That's how when we see a skeleton, maybe we discover a skeleton under earth, we actually find out, okay, this is male, this is female.
Right.
Because of few changes.
Okay.
Okay. Also, we will talk about this feet and where we have little cone-like structure. Because of that, we always have lower back pain sometime in our life, either in 50s or 60s or 70s.
Okay.
Because we evolved everything, but only thing which is not evolved is our ankle evolution.
Okay. All right.
There's fantastic, documentary how a human evolved in discovery. But I would request you if you can draw this part separately and this part separately, and the muscles you give different colors, just for your mind to keep that in in memories. Because if I draw, I will draw it. Your drawing would be pending. So rather you draw it. I want to see that.
Okay.
And this is, if you look at this muscle, this is called middleus, but look at that shape. This shape is known as teardrop. So whenever you're drawing someone's this part, you always give this teardrop shape. You look at here. It's always teardrop shape. So the name gives you an idea that how to draw that part.
सर सॉरी, आज मैं सिर्फ रिकॉर्डिंग देख रही हूँ, आज मैं सिर्फ देख रही हूँ क्लास। मैं इवनिंग तक आपको लेकिन वर्क करके आपको
No problem, whichever is comfortable.
यस सर, सॉरी।
No problem, no problem. How are you placed in? Something happened.
Is this two set of bones, the one from the hip to the knee and from the knee to the ankle?
Yes.
Are they both same size or does it follow the golden 1.3?
It's not same size. One femur is the longest bone.
That is the
Thigh bone.
Thigh
This is
bone?
the femur. The
Okay.
femur is the longest bone of anybody. Okay. Also, one thing you will notice, say again, I am 5'9", someone is also 5'9" or same.
Yeah.
And we are both sitting because of our proportions of upper torso and lower torso. We are sitting on a same edge. Still, probably my femur or my knee position would be much further than the other person who is sitting next to me. Or someone is from the Haryanvi or that northern part. So what happens that their upper torso is smaller than the lower torso. But someone from tribal on hills, their upper torso has longer than the lower torso. So when you see them, they look much shorter, and that's why they wear their jeans little lower. If you look at their styling and all.
Okay.
Okay, so that's one of the reasons that you look at Messi's body. You follow football.
Yes.
You see Messi's body, and the moment you see our Indian football player who travels, their shots are much powerful shot, though they don't have such a big. So if you look at Ronaldo's thighs and your Messi's thighs, you will not see Messi is very masculine like in Ronaldo. But Messi's shots are much stronger than Ronaldo's shots.
Because of?
Because of the length of body.
Oh, okay.
Okay. So it matters the amount of energy you generate.
Okay.
I'll come to those signs later because it is not purely for this, but if you're interested, then we can talk about all those parts. That how the weight displacement matters the human body's the movement of weight.
Right. I'm trying to sketch. Is that okay, or do you want to continue with?
No. I want you to sketch. I want you
Okay.
to sketch. See what happens that if I continue from here, the next slide, what will happen that you will maybe or someone will miss out drawing this. So I'm forcing so that it remains in your brain, and you are doing it with different colors.
Right. Okay.
Yeah. So for me, I know the bone structure how it would be.
Right. Sure.
सर एक चीज डिस्कस करनी थी कि
Please.
जैसे मैं अलग एंगल से ट्राई कर रही थी हैंड्स को, मसल्स को, तो मुझे थोड़ा प्रॉब्लम हो रहा था। मतलब कौन सी मसल ऊपर आएगी हैंड मसल में, मतलब थोड़ा सा पता नहीं।
ठीक है। सो क्या हम लोग एक कर सकते हैं कि वी लुक इनटू द हैंड इन डिफरेंट एंगल, 360 डिग्री एंगल। ओके, हम लोग या ये बहुत इंपॉर्टेंट है, इसलिए ना आप इफ यू लुक एट माय रील्स, इन प्रीवियस फ्यू रील्स, I generally, if I have taken any photo of reference, then I take 2 different angle, 3 different angle, top angle, bottom angle, side angle of the same photo. So it's very important to do that understanding. Okay. So it's a very good thing, Ruchika, you just brought this topic.
अगर आगे जा रहे हैं लेकिन पीछे का थोड़ा सा क्लियर नहीं हो रहा तो
Yeah, absolutely. You should bring that thing. Otherwise, I won't be knowing that what you are getting difficulty, and then later on, then it creates a problem. Only thing to observe, the patella in front of this, this is a kneecap, which is also known as patella, which is not showing here. It's only showing the joint, but here the artist has shown it here. Any of you ever did a strength training in life?
You mean going to the gym?
Yep.
I have not lifted weights, but I've done the dumbbells, those kind of.
Okay. Why I'm saying, when you do workout or strength training in gym and all, you start realizing and understanding human anatomy, muscles, and the movements much better than normal people. It really helps you. Anyway, strength training is a life savior.
Yes. Shall I just show what I've done?
Yeah.
Hold on. Is it somewhat visible?
Yes. Can you bring it a little down? Okay, perfect. Now let me unshare it and to show you something.
Okay.
Can you see this photo?
Yes.
Okay. So this is Tom Platz, one of the greatest bodybuilder. Now I have taken lot of photos like this. Why we have chosen bodybuilder? Because they have taken their body, enhanced their muscles in such a way a normal human being cannot. And for us, we are not the Leonardos or Michelangelos that we will go to morgue or we will take out body from underneath and then we'll peel off the skin to see the muscles. We are not mad like them. But we have these bodybuilders now. What I've done is that from their body, we've taken a black and white photos and we started mapping the fiber direction. Okay, that gives a sense of understanding that how the fiber would look like. So this is one. Second, though this is the entire back and all, this and again one of the greatest bodybuilder called Ronnie Coleman, if you have heard. But anyway, then again hamstring, which will come to it. I just want to show that how the muscles moves and how the fiber moves because the direction of fiber tells you the movement of that muscles. We will do this next week when everybody is here. I will send the photos. You just have to take a black and white printout of that so that you can start drawing with different colors. So if you look at here also, it exactly looks like teardrop and then all the muscles movement, whether it's the oblique or abs or the lat or the chest. How does it move? What actually helps it movement, why the fiber directions are like this, it will give us a sense. And once you understand this, then as Ruchika mentioned that she's getting problem in finding out the when she's looking for different angles, she's finding difficulty. That's why I say that let us do this. Like this is the hand, now this is tricep, how the tricep would look like from different angle for different people. So let us understand that also from our perspective. So what I've done is that while you were drawing it, I just drew this part just to understand from where it would look like and how it would look like. Now, this part, if you look at this part, if I look at the section, there is a called hinge joint. You remember hinge joint, we talk about it. Say this is point 1, 2, 3. Now this 1 is your pelvic joint where pelvic and femur is getting attached. This is the knee and this is your ankle joint. From here you have a feet coming in. Okay. Now as because it's a hinge joint, you remember the door opens and close. The door has a hinge. It has similar hinge. That means it will move from here and it will come back here, but it won't go this side. This side it will not go after this straight line. So it has a restriction of movement. Same in our hand. Now this is the man whose front facing is this side is the front facing, and this is the shoulder point. This is the hand. If I make the straight hand, this is the 3 joints. One is this is elbow, shoulder, wrist. Right? Now their movement, depending upon the angle it creates and the volume of muscle, this is the extreme angle. Now, for me, if you look at my other skin, can you see my hand where I'm waving the hand?
Yes.
Okay. Now, because I have larger muscle, now I cannot take my hand at this point. So here I have a restriction. I cannot move. But if I see Ruchika, Ruchika can go easily. She can hold this shoulder part. Right, Ruchika?
Yes, sir.
But I can't. It's not that I don't have the stretchability. It's just my hand doesn't allow me to move because it's been restricted by the muscle. So my this movement will this angle, the last point of angle will be decided by the amount of volume we create in the hand. Is it clear, or should I give you for few more examples?
Yes, sir. Clear.
It's
Okay.
clear. It's clear.
Now, what happens here at this point? So at this point, we have a muscle which looks like this. If you find it's too basic, please let me know. Then I will move to, rather much complicated part. But this is how it is. This is the cartridge and muscle is there. Okay, now muscles, the direction.
This is arm you're talking about?
Yeah, it's arm, but any muscle.
Any one. Okay. All right.
Any muscle. But right now I'm talking about arms, but
All right.
any muscle, this is what happens. The direction of muscle shows that the muscle will move like this. Okay? That means the muscle's movement will be either it will be stretched in up direction or it will be squeezed. Okay? So now, if it squeezes, what will happen? Same thing happen with a rubber or elastic, that it stretch and when you leave it, it comes back. Okay?
Yes. Okay. Understood.
And this define that this part earlier was here, it has moved to a certain point. So my movement of muscle decides that what it is going to do. So if I have to pick my hand, if I'm doing this movement, it is only happening, somebody's pulling this and then it is releasing it. Pulling it, releasing it. Like my hand, this part, if it has to move up, then this muscle has to pull this. And if it has to go down, then this muscle has to pull back. So if I am pulling this, then this is getting stretched. And if I'm pulling this, then this is getting stretched. So if you put your hand like this in a wall and you try to stretch it and increase this angle, you'll see there's a huge stretch you're getting it. Either muscles are getting stretched or it's bit squeezed. Now what happens here? Again, you look my hand here. The moment I do this, this size increases. Okay? We'll keep this in mind whenever we are drawing these arms. What Ruchika was finding difficulty in drawing different parts is when she was drawing it, she needs to understand how the volume changes, how the body shape changes as and when we shift, we look at the angle. Okay. This is one part. Please remember. Now, the person you are drawing, if that person is a lean guy, his movement will be different. If the person is, how would you say, a muscular guy, the movement would be different, and a fatty guy, movement would be different. Now, we understood. We understood the muscle movement. Same thing happened in jeans also. Suppose you're wearing a tight jeans and you need to get up to a bike. You remember what we do? We pull our pant like this, our jeans like this, and then we try to sit and hop over the bike. Why do we do that?
Muscle stretching.
Yes. You know what happened? Our biggest muscle is our thigh muscle. Now see, okay. Say this is our straight leg. Okay. This is our straight leg. The movement it goes here, this muscle pulls and the thickness increases here. So from here, it increases to here. But your jeans has a limited space. So suppose you have a 24-inch thigh and you have only 25-inch of jeans, your muscle may be squeezing almost 26-inch. So the muscle has to accommodate 1 inch additional circumference. Getting so we feel tight and we feel the restriction of movement. So that's why we pull our jeans so that we have additional cloth to fit in this additional 1 inch circumference so that we feel comfortable. We get the range of motion, we increase our range of motion, then we hop on the top of the bike. Next time you do, you remember this.
That's a good example. Yeah.
Yeah, I mean, like it used to happen. See, when I was in Levi's, when we designed all those things, so it was always in mind, and we used to tell people, the customers, that sir, if you're wearing this, then you would find this difficulty in coming time when you're hopping in bike and all. So we would suggest, why don't you go for next size? So this one of the reason. Okay, let's go to the other section where Ruchika was finding difficulty. Now, Ruchika, any idea which you are doing, which position you are doing it, and you got difficulty?
सर एक्चुअली मतलब ड्रॉ तो हो पा रहा था, लेकिन
हाँ
जब
जी।
शेड कर रही थी मैं उसको, तो मुझे ये नहीं समझ में आता कि कौन सी मसल बाहर मुझे कर
पॉप अप होगा, कौन सा नहीं होगा?
यस सर, करेक्ट।
अच्छा, ठीक है। Was it man or woman?
मैन।
Okay, fine. मस्कुलिन था, फैटी था?
मस्कुलर।
मस्कुलर।
मैं शेयर करती हूँ, एक तो मैं ड्रॉ कर रही थी लेकिन मैं शेड नहीं कर पाई इसको, तो एक बार मैं दिखा देती हूँ।
ओके,
यस सर। इज इट विजिबल?
आपके ना वो बैकग्राउंड ब्लर वाला है, तो
अच्छा, मैं ट्राई करती हूँ।
अच्छा, थोड़ा बहुत तो मैं समझ रही हूँ।
उसका एक हाथ नीचे फ्लोर पे रेस्ट कर रहा और दूसरा थाइस पे।
Okay, 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 okay. Got it.
Can you share that picture on WhatsApp, please?
Yes,
I cannot
yes.
understand.
Yes,
Yeah.
I'm sure.
वो बेहतर होगा, please.
Okay. Thank you.
I love this. Yeah, Manjit, you were saying something.
No, so it's just a request or a kind of a suggestion that, if we are sketching, I mean, I think everybody is doing directly to Hirak.
Yes.
Which is also fine. But if we share in the group, I think one is you can understand, and if you give corrections, then you can understand from other people's sort of drawing also. And I think there is motivation that, oh, others are drawing, so let me also do a couple more.
Yeah, that's one of the reason I create, but sometimes we feel that okay.
नहीं ये अच्छा है काफी सर, sing good.
So can we share in the group whatever picture that we draw? I mean,
Yes.
there's no judging of, we're all learning. No?
Yes, sure.
Okay, all right, thank you.
Okay, Ruchika, first couple of things. Okay. You remember I was talking that when we play and there's a lot of blood comes in, then our muscles changes the appearance.
Yes, sir.
Okay. Now look at my hand. Okay, let me shift it a little bit so that if someone is watching the video, now look at my hand. Okay. Now this is my normal movement. Okay. Now I'm squeezing it. See the change in my hand. Okay. Again, let me switch off this. Okay. Now see, this is normal, and I squeeze it. You see, all these things are popping up.
Yes, sir.
Okay.
Mm-hmm.
Now, if I can show something like this, hold on. I have to show different lighting. Now, if I am like this, my hand, okay, I try to hold something and my light changes. See, I can pop up my tricep from here, and then you can see this is the bicep area, this is the tricep area. Okay,
Yes.
I just hold the hand and I twisted it. I hold the hand and I twisted it, and see, this is all coming up. This
Yes.
my triceps, and then this is my forearm, which is popping up from here because a lot of lights are coming, and this is really tight at this moment because my hands are, I have really stretched it, a lot of tightness. So see, the shine is different, but the
Yes.
moment I lose the tightness, the shine changes.
Yes, sir.
Again I am doing, see, I have stretched it, stiffed, बहुत ज्यादा टफ करके रखा हूं, तो यहाँ पे मेरी जो शाइन है वो भी चेंज हो रहा है.
Change हो रही है.
So not only your lighting changes, your body shape changes. Okay, we'll keep all those things in mind and we'll try to draw people. Okay, so first, the preliminary stage, the first thing you do is that bring your cone and the fundamentals in place. First thing is do. What is our fundamentals? That if I'm drawing from the front, this is my hand area, and say I'm drawing a straight line. So you've drawn this. Okay, and we have a circle here. This is the first thing we have in our hand. Now we want to give it a direction. Now what direction? Which way? Is my rib cage is straight looking out like this? Or only thing that I have changed my hand position? If I change my hand position, just see how I'm doing it. Okay, let me see if I can show you like this. Okay. If not visible, let me know, huh? Because when you do live, see, when my hands are straight, huh, and I'm putting it like this, can you see my hand position? This biceps, okay, this is the forearm coming in, and my bicep is inside.
Yes, sir.
And from here, you can see the triceps are coming up. Okay. Manjit, if there is any problem, you let me know, huh?
Yeah, I can see. No problem. Yeah.
Okay. Now, I am moving this hand to here the way I have drawn it. I'm moving my hand to here. See how it opens up, huh? Now my entire body weight is on my hand. I'm standing and पूरे body weight इस हाथ के ऊपर है. मैं हाथ को shift कर रहा हूँ because मेरी hand position change हो रहा है. See, my bicep is opening up. Here, this, because मेरा हाथ ऐसा है, अब हाथ को ऐसे move कर रहा हूँ, तो मेरा bicep move हो रहा है, ये forearm move होके मैं सामने की तरफ हूँ. Now my entire thing has changed. My triceps has gone back. I can't see much tricep. Only this has opened up, and then this has moved. Now the hand, how the hand is like this? See, this is the hand position. Now I change. See how everything changing. Now the moment I see, my backside of the wrist is coming up, the backside of the forearm. Okay, one more thing. See, let us understand all the muscles. एक बार basic clear हो गया तो इसके बाद और कोई दिक्कत नहीं होगा. Okay? Now look at the hand. Let me move this little. This is the hand. This is on the top part. Okay. Now where is the maximum muscle is there? That's very important when we change our shape. So look at here. we have muscles here. So this part we have additional muscle, but this part has the maximum muscle. Can you hold your muscles like this and press and see? Can you feel there are a lot of floppiness muscles here?
Yes.
And then you can see the bone here. Can you press like this?
Yes.
The bone, you can feel the bone from here, 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 till here, you can feel the bone. रुचिका आपके बोन दिख रहा है, मिल रहा है ढूंढ के?
सर बोन से दिख रही है। I have very less muscles. इसीलिए मुझे
ये सब कैसा है, थोड़ा बहुत मसल सबके पास है. See, everybody has same muscles. किसी का थोड़ा सा ज्यादा है, किसी का थोड़ा सा कम है, बस इतना ही.
इसी वजह से शायद ऑब्जर्वेशन वीक है.
अरे नहीं. तो anyway, and then you have one more muscles. ये मसल्स नहीं होगा तो मूवमेंट ही होगा नहीं. ये देखिए मूवमेंट कर रहा है ना, तो एक मिनट में इसको बंद कर देता हूँ, शायद आपको यहाँ पे ज्यादा अच्छे से दिखे. सी यहाँ पे जो मूवमेंट हो रहा है आपको मसल्स का, ये जो मसल है ये देखिए ऐसे पॉपअप हो रहा है ना, इसको पॉपअप हो रहा है बिकॉज मैं यहाँ पे इसको खींच रहा हूँ, एंड देन आफ्टर दैट इट्स नॉट गोइंग बिकॉज इट हैज अ लॉट ऑफ स्ट्रेच हियर, एंड दिस लॉट ऑफ स्ट्रेच, एंड देन द मोमेंट आई डू इट, मेरी ये वाला मसल मूवमेंट हो रहा है. ओके, सो जस्ट विल कीप दिस इन माइंड व्हेन आई एम ड्राइंग इट. आई होप दैट्स क्लियर.
फैट इफेक्ट दिख रहा है सर.
ओके, अब हम लोग यहाँ पे आते हैं. सो रिमेम्बर व्हाट हैपेंस व्हेन आई, आवर पोजीशन अगर ऐसा था, दिस इज माय से फर्स्ट पोजीशन, वी change the direction to second position, what happens? Our bicep opens up. Okay. Then our shoulders will be here, and now whatever you saw, I'm imagining it and drawing it. At the moment I remove this, this is how it will look like. Now we have to find out that which direction I put the light so that I can show the entire ups and down in the volume. When it was here, when the hand was here and it's pressurizing it, so my hand position was where this is my triceps, this part, everything was visible. It was like this. The moment I changed and shifted it, this part twisted and it shows like this. What happened in the other side? What happened if I see things from the back side? From the back side, so when from here I do like this, okay, again, can you please, you don't have to switch on your video, but can you stand like me, put your hand on the table, so this is, my hands are straight, I turn like this, and you hold here, and can you feel what changes here happens? Can you feel what changes it happens here? I just want you to feel it. कुछ नहीं हो रहा है, it's okay. हो सकता है कुछ नहीं होगा।
थोड़ा सा ट्विस्ट होके पीछे चली गई।
ओके ओके, क्या होगा? ओके, few people also has hyper extended hand, but I will show you what happens here. I can give, this is from the side view. So the moment you twist this muscle goes backside, and then enter rear tilt and all changes. This is the side view. Because it has twisted, you see this thing pops up and your hand looks like this from the side view.
Yes, sir.
Okay, this, and few people will have extended hand.
Is
So
this position 2?
this is position 2. Because
But
we are
camera is coming
looking from
the
this
other
angle.
side. Okay, all right, okay.
Okay, so this we are looking from this angle. Now, if we look at from the back at this position, if you look at from the back, I'm drawing it here, huh? Just to compare. This is, can you see? Okay, hold on. Because people would be seeing, watching it, the recording part. See my hand? Can you see this part?
Yes.
Huh? This is
Yes,
what
sir.
I'm drawing it.
Mhm.
The moment you twist it, this part will come. See, I have twisted my hand. See what are the things visible
Yes, sir.
from backside?
Mhm.
Huh? So that's what I have drawn it here.
Can you spotlight that, please?
I did I spotlighted you?
No, your face is.
Okay. Now see, this is what, and now I am drawing the other page.
Okay.
Okay. Now, how generally this is your whole part, but because of the shape, it will looks like a full volume, and it won't give you a sharp curve. It won't give you a sharp curve. It will be a bulge out swelling muscles. But this part will be very much sharp. So if I start giving shadows, I think it is getting hazy, but this is how it should look like. From the back side.
Yes, sir. Clear.
This is from the side.
Beautiful.
This is from the front.
So this takes 360 different drawings.
Yes, yes.
To understand. So it's only experience and probably try out with your own sort of.
Yeah, your own body. You just try to feel it because see the gym में जाके ना most of the time we see ourselves only in the mirror. We don't see anyone. Okay. We have
True.
seen so many times every day doing the different workout and all. And as because I have a lot of interest in it, so I keep observing people. I keep observing myself just to find out that how does it look.
Right.
Because I always, the Leonardo's, the Michelangelo's stories always fascinated me. I cannot do that what they have done. So what else I can do is that even I have watched videos of medical science videos where they are doing dissection of human body.
Oh,
I have watched those also just to understand how the muscles are.
I mean, as a joke, let me ask you: do you draw, figures without muscles? I mean, lean fellows.
Yeah, I do draw it. See, what will happen? The same fellow. Now, this is very interesting project. We are going to do it, but probably after some time. Let us understand the same thing, same position. You draw it for a man, for a man in three different fat level, a woman three different fat level. It clarify all your doubts then. So the moment you start drawing this for a fat guy, this entire situation will be very different, much easier. And again, if you draw it for a lady, it will be much easier.
That is always a challenge for me. This whole man versus woman, even if it's simple facial thing, man somehow I can manage, but then one face, it's quite impossible for me. I mean, I'll learn from you after some time, hopefully.
No, that's what I mean. Like, let us figure out the man's first, and then we will also go to move. But when we learn muscle, let us do the man.
Okay.
And when we will be learning the softness, we would go to woman.
Okay.
Also, most of our models would be women and the drawing part because we have to study the nude images of everybody. In that case, we need these pictures. Indians pictures are not really available, but we have. So I have books where multiple models has given their pose. That books is been made only to draw.
Understood. Yeah.
So hundreds of nude poses of man, woman, African, European, to study them, different positions, and it really immense. It gives you immense pleasure of drawing those because those are not all masculine. Those are all not fatty guys, lean guys. Few are fat, few are old. When old, your skin will loosen. So we are not even talking about the old people. See, the maximum people, what mistake they do, the moment they start doing wrinkles. If you have a wrinkle like this, okay, I don't know whether you can see it or not.
Yes, visible.
Yes, sir, visible.
Okay, let me just zoom it. Now you have a wrinkle like this. So people generally say they make this part. वो ऐसे कर देते हैं, ये रफ होता है. But the same thing, if I give it a little layer of it and I mellow it down, then it would look different. The wrinkles start looking much better. And then you mellow down here.
So is that more gradient?
Yes. So what happens that the wrinkles uh, in our body, they start. Okay, let me show my hand. Okay, this is my hand. As of now, I haven't started having wrinkles much, though I'm almost knocking the door. बुढ़ा होते जा रहा हूँ, but anyway, let me do something. Can you see my skin?
Yes.
This is going to happen after 15 years for me. And this is 15 years before of me. This skin. This is after 15 years. And this is today where I am. Got my point? Now this wrinkle, if you have to draw, see how soft this is. Though it is wrinkled, but it is still soft. It's not hard. So the moment you capture these shadows, can you see the shadows in between the wrinkles?
Yes.
Yes.
तो वो शैडो जब आप ड्रॉ करते हो शेड में एंड आप उसके ऊपर एक लेयर नहीं दोगे ना, ये अलग अलग दो पोजीशन होगा. द मोमेंट यू पुट वन लेयर, it would be a part of single skin because
Okay.
your skin is only not moving. Your skin has 7 layers. All the 7 layers are moving. We can see only the first layer. So you always remember this.
Okay.
Whenever you do wrinkles, you have to bring that extra layer on the top of it. You'll see, you try it out, try some old guys. Now, the challenge would be for us, we have a reference, we have a subject to mention in our painting, and that painting, that person has a wrinkle in the hand. How to portray that wrinkles? That would be challenging for us. So that's why let us first do this, and from here we will move to all those parts also. We will observe different people. Is it clear till now?
Yes, sir.
Yes,
Thank you,
it is.
sir.
Okay. कोई भी क्वेश्चन यहाँ पे? Anything?
Nice, sir. Thank you.
Anything you can ask. See, the more you ask, the
Can
more I would indulge into bringing more and more example. Only thing will happen, it may slow down the process. Okay, I was moving to feet and next to next to next. I was moving faster. Maybe it will slow down that process. But the more question you ask, the better for everybody.
Can I ask something?
Please, please.
Okay. So look at the picture that Ruchika ji has shared in WhatsApp. Can you do a quick sketch? I mean, I'm not asking for a full shaded one, but can you do that on the screen so that we can understand her picture versus how you will make it?
Okay.
Thank you.
So let us. This is the same thing I would draw, but only thing difference is that if I understood rightly, that this person, the angle of movement is here and here, right? And रुचिका जी, उनके पूरे बॉडी की वेट इस हाथ में है?
Yes, sir.
Okay. देखिए, अगर मुझे इस बॉडी की वेट इस हाथ में देना है तो I have to find out my CG. Is my CG is right on top of it? May not be because यहाँ से दिख रहा है. Okay.
What
So
is CG?
Center of gravity.
Oh, okay.
Okay. Sorry, I gone into a short form. Okay. उनके
No, that's
picture
fine. That's fine. Next time I'll remember. So we'll learn like this.
So one thing is, क्या मेरे हाथ आप साइड से अगर देखते हो, okay, this is static. क्या मेरे हाथ ऐसा है या सामने की तरफ है? If the angle is here or angle is here, both will have a huge difference from the front side. This is position 2. This is position 1. Ruchika ji, which one is like this?
Sir,
Getting my point, because the moment I'm going to draw this for my movement, this is very important. And accordingly, my body weight will change and my CG will change. Okay, I presume something.
Mm-hmm.
Okay, so
Can I say a suggestion, and
yeah.
Ruchika ji can confirm? This picture looks to me like it's like a bricklayer. मतलब वो the one who makes the walls, brick का ऊपर brick रखे. So the left hand is almost resting on the brick wall, and the right hand is sort of bringing the new brick to the brick wall. That's what I feel. Ruchika ji might be able to explain it a little better.
Actually, my son was sitting like that. तो मैंने उसको थोड़ा सा कैप्चर किया था, तो वही ट्राई कर रही थी मैं.
Okay. So ये स्पाइडरमैन वाला पोजीशन है काइंड ऑफ. ओके, रुचिका जी आप मैं थोड़ा इसको निकाल देता हूँ so that I can talk about it. So as a quick thing, you tell me. And first, I'm determining that how your son was there.
मतलब उसकी मसल्स नहीं है, लेकिन मैंने
हाँ, obviously. Was something like that. He was.
एक्चुअली वो नीचे से उठने के लिए ऐसे कर रहा था, तो मैंने तब नीचे से उठने के लिए जैसे एक थाई पे हाथ रखते हैं, एक हाथ नीचे जमीन पे रखते हैं, तो
ओके, तो ये मेरा हाथ यहाँ पे होगा. यहाँ पे होगा थाई के ऊपर.
हाँ जी.
काइंड ऑफ.
हाँ जी.
ओके, सो दिस इज माय पोजीशन. अगेन, तो ये हाथ ऐसे ये टेढ़ा नहीं होगा.
Yes, sir. This is the correct position.
Now what's your son name?
Sparsh.
स्पर्श कितने वर्ष के है?
Sir, he is 14.
14. Wow. So Sparsh, after 8 years, after going to gym, मैं थोड़ा सा ड्रामेटिक देना चाहता था फिंगर, but I'm not giving it. And then his collarbone will be much little less, and then ये अंदर की तरफ जाएगा, this rib cage, and then from here we'll have our feet like this. Now यहाँ पे ना that means this is the teardrop. Okay, this is our patella, जो नी बहुत ज़्यादा stretched and exposed रहेगा, and this is the part which is our calf muscle and then seam muscles inside. This is how it will pop like this. But again, it's very evolved muscles. But ये हाथ और छोटा आएगा. This will go little back and this will go little front. But मैं उसको evolve दिखाने के चक्कर में I made it bigger. But this will not be much bigger. This will be backside, so it's थोड़ा छोटा हो जाएगा. That's the only difference. But the hand would, if I remove this, the hand would look like this. This is how it would look like. Okay. So ये शोल्डर जो है ना, नॉर्मली शोल्डर जो हमारे, अगर मैं स्ट्रेट देखता हूँ, माई शोल्डर, द trapezius would look like this, and this is my collarbone, and this would be the shoulder look like if I look straight. Now that it has bent, तो I could see the back side of it. तो ये जो वॉल्यूम है ना, ये वॉल्यूम ऐसा रहेगा, इतना वॉल्यूम दिखेगा मुझे,
हाँ जी।
क्योंकि वो झुक गया है। तो अब देखिए, आप अगर मुझे देख पा रहे हैं आप दूसरे स्क्रीन में, तो मैं, अगर आप ऐसे देख रहे हो तो दिस इज व्हाट यू सी मी ना। अगर मैं झुकूंगा तो मेरा बैक साइड दिस इज आल्सो विजिबल।
यस सर।
सो द सेम थिंग व्हेन इज लीनिंग बैक, तो कितना लीन कर रहा है वो डिपेंड करता है।
And how about the right hand?
Okay, now the right hand part. So let's see the right hand. Now the moment I take this, my upper part will pop up. So मैं थोड़ा सा छोटा करके यहाँ पे बनाता हूँ, otherwise if we go to the next stage it will be different. Okay, let us
Okay,
draw
no
here.
problem. Yes, yes.
Now I would prefer that this goes little bit up angle also, okay, so that it can accommodate the hand on the top of the knee. Okay. Now if it is almost similar like this line, if it is similar like this line, so how would you do is that this part, this is the shoulder part. This is the tricep which will pop up like this. Comes your elbow, which will be exposed, your bone, and this is the cone shape. And I remove this part so that I can show. Now, one hand would be on the muscle, holding back the muscle, and the rest of the part will be inside, because you will be seeing only the knee part, rest will not be visible. This is how, and this could be long if the angle was long, but we are seeing little tilted long. Yani, from here you see my hand this much, but if this is long hand and this is, the angle changes. That means the cone, from straight, the cone looks like this, but if we change the angle, the length of it is changes. That's why we change the length.
Yes.
Okay. So this is how it will look like. Again, this is the collarbone, and the chest will come like this, and then back. So your entire scenario changes, and you give that definition.
So now you've drawn this with like a grown-up man who is an adult
Yes,
who
yes.
is
After 8
muscular.
years, so when he would be 22, he has gone to gym for 4 years. After 18, and or maybe later on when he has grown muscle, because Ruchika ji wanted to add muscles to it.
Yes.
So if you want to make it a boy who is not very muscular, then
Then
this
nothing,
it will
nothing.
be easier, right? Once you know the
Much easier, much
Okay.
easier. But
Okay.
at the age of 14 also,
Okay.
his hand, see, the pop-up will be there, and I'm assuming that he is not much fat guy. This will be it. Now, if you put a t-shirt, because he is lean, the t-shirt would be like this.
Okay.
Yes, sir.
Okay, so this will be the hand position. Now, what I need is that, can you try that? She tried this fantastic, so that a lot of thing comes up. Whatever you see, can you draw them? Take a picture. I mean, like, That day I
Yes,
was
sir. Next time I will take the picture.
no, picture in a sense. Now you are suppose somewhere.
वो उससे easy हो जाएगा ना पूछना अगर कुछ problem आ रही है तो
हाँ,
पूछना भी easy हो जाएगा.
see what I've taken is that how strange this is. This is in Hyderabad. I was eating somewhere and I saw this. People are waiting. Look, everybody. What do you see? What I don't know whether can you see this?
Yes.
Sir, yes.
Okay. What I see, I'll tell you. Right.
Same height. Similar. It's kind of very, very similar. Oh, you're talking about the cables, not the people.
No. It has gone up. It is. I'm unable to. Okay. Okay. First, it is this. Look at everybody's position. The arch.
Okay. Yes.
See the hump. See the hump. If you are drawing this era of people, then we have to see that how they sit, how they stand, how they, their body position. This is how our world has become. This is how our world has become. This is the Aam Aadmi, general public. So how do we address this? How do we draw this? So I keep doing it and then I try to use it for my references. Now ये तो जनरल पब्लिक है ना, तो जनरल पब्लिक यहाँ पे नहीं जाते, तो देखते कि और क्या क्या करते हैं. Okay.
No muscles drawing needed.
And no muscle drawing needed unless and until you see them in a right way. Trust me, I mean like लोग कितने गाली देते होंगे मेरे को. I am not getting it. Hold on. I'm not getting it. I might be deleted or my son has deleted it.
Do you have another class at 11?
Yes, I have it.
It's already 11:06. Huh?
Oh, okay. But no problem. I cannot break this flow. Can you see this person?
Yes, sir.
See how he's sitting, how
Yes.
beautiful. See, because of the okay. Because this is just this much. No, look at the t-shirt part. Small thing makes so much difference. Muscles are all there, which we talked about it, right? Is the amount of muscle is less. This is normal thing which you see it here.
Yes.
This is what we have to bring in. But when you know, see the Purohit's, the Panditji's shoulders, muscles are still there, right?
Yes.
This part.
Yes, sir.
See how it is popped up? All the muscles are there. This is the rib cage. Only thing, this is metabolic syndrome. Okay. But anyway.
And his feet is in the air, so that gives the feeling of it's walking. Yeah. Middle of motion.
Correct. So that's how you bring these small things, changes, that it is moving. How do you bring the movement in your drawing? By small things like this. Generic thing. But this is much of a North Indian, probably. This is a Calcutta thing. This is written in Bengali also. So in Calcutta, the chai thapris are like this. So anyway, these are just an example for every one of us to understand how it is. So I would request you that please watch and draw and try to draw different angles the way I have drawn it here.
Yes, sir.
Try to find out that what are the difficulties you get it, then we can indulge into it. And let's make it all masculine first, so that muscles remains in our brain, and then we can play around, we can manipulate things.
Understood. Okay, we'll do that.
Yeah.
Yes.
Thank you
Thank you
so
so
much.
much,
And
sir.
sorry I started late today.
No problem,
No
sir.
problem, Hiran.
Yeah.
Thank you
Thanks so
so much,
much.
sir.
Thank you. Have
Okay,
a good
bye. Good day.
have a good week ahead. Thank you.
Thank you. Wish you same.
Thank you. Bye.